everybody, and welcome back to my channel. And if you're new here, welcome. My name is b.eeana and I'm a third-year medical student at ADO school. I'm going to keep the intro nice and short. Here is my 6 weeks of family medicine. I hope you guys enjoy the video. So I just took my lunch break, and since the family medicine office that I'm working at is at the same hospital as the psychiatry rotation, I'm basically able to eat lunch with the social workers every day because there's not like a designated lunch spot in the family medicine unit. So every day for lunch, I just go eat with the social workers, which is really nice because they always have things to update me on, and I miss them and I wasn't ready to leave them. So at least I'm still kind of a part of psych. My last patient of the day was literally scheduled for 3:40 and I'm not getting out until 5 because she came in for one complaint, one problem, and then ended up bringing up a million other things. And this is the same thing I had a gripe with during my internal medicine outpatient rotation. So I'm working with a different physician today at a different office, and he has his little office dog in here. He just tore up a box of tissues and got into a little bit of chocolate and tore open his container of peanut butter. So I am taking him out for a walk because clearly he's got too much energy. Second week of family medicine. It's pitch black out. I'm getting out at 6 p.m. This is so unlike psychiatry, and you can't even see me anymore. Not to mention, it's 34 degrees out, guys. And 7 days ago, it was 75 and sunny. And now it's 34. I can't do this. Hello everybody. It is basically the end of my second week of family medicine, and I feel like this vlog has gotten nowhere. I haven't given you any updates, and I'm barely recording anything at all. So my bad. I honestly don't really know why that's happening. I feel like family medicine is a lot more low-key than I was expecting, and not that many exciting things are happening. So that's why I feel like I don't have much to share. In psych, when I was reporting back about a ton of different patients with a ton of different diagnoses and presentations, but in family medicine, I'm kind of getting a lot of the same, which I enjoy because then you get really good at the things that you get good at. But I haven't had too many exciting things. Really, the only thing I can think of to share is the fact that this week I successfully performed 2 shave biopsies on my own. I had never seen one. Usually physicians will say, see one, do one, teach one. So you see some type of procedure happen, then you do a procedure, and then you teach someone how to do a procedure. But for me, there was no see one. It was just do one, and then do another one, and then do another one. So it was really cool. It was a very small procedure. The first man that came in, he had a lesion on his scalp. It had irregular borders, and it was sort of kind of a funky color. And then when you look at it under a microscopic lens, and it kind of zooms you in, it actually looked a lot like a very irritated seborrheic keratosis. And he had another one on his scalp. So when we compared, they looked very similar, except that one just looked like it had been a lot more irritated. And the patient did report that he had been scratching that one for a long time. So we had suspected it was a seborrheic keratosis, but of course, just to be safe, in an older gentleman on a sun-exposed area with a weird lesion, we always err on the safe side and perform a biopsy. So I did a shave biopsy by myself. The doctor literally just stood next to me and kind of gave me the directions, but I did all of it by myself. So first thing was betadine, and then alcohol, and then we put like a surgically sterile cover over the area, and then I numbed him up with lidocaine all by myself. And I felt really bad because the scalp is a really sensitive area. So just imagine someone sticking a needle into your scalp. It's quite painful. So he was like twitching, and I was getting really nervous that I was causing him severe pain. But then after like 10 seconds, he wasn't feeling anything at all. So I knew the lidocaine was working. So that was cool. So after I put in the lidocaine and made sure everything was sterile, I performed the shave biopsy. It was like this little tiny razor type of thing that could bend a little bit. And I just scooped slightly into the dermis to take out the entire lesion. We put it in a little cup to send off to pathology, and then that was that. And then yesterday I did another one all by myself. It was, this time it was a corn. It was kind of like a verruca wart. It was pretty funky looking. And you guys, if you've been watching for a long time, you know I don't really like derm stuff because it freaks me out. But I performed a shave biopsy of that one, except minus the biopsy. Family medicine doctors that I work with one person Monday and Wednesday, an older gentleman who has been in practice for like 40+ years. So a lot of his patients are established and older. And then on Tuesdays and Thursdays, I work with a younger physician who literally just graduated residency, I think about a year ago. So she is in the process of generating a new patient panel. So a lot of her visits are establishing care, annual physicals, some chronic disease management, some acute visits, but really nothing too crazy has been happening. So I feel like that's why there hasn't been much to update. Hopefully some other cool things happen over the next few weeks so I can let you guys know about it. But until then, there's not much going on. Guys, I don't know what it is about family medicine that is so exhausting to me, but man, it is so exhausting. Mondays and Wednesdays can be tough because it's 8 a.m. to 6:30, and family medicine doesn't always have the most exciting stuff to see, at least in comparison to psych. You know, when you go from inpatient psychiatry to outpatient family medicine, there's like a huge difference in the level of acuity. With the other physician that I work with, she's much younger, she's a newer physician. I really enjoy working with her, very knowledgeable and very in tune with what med students go through. So she is all about me taking care of myself, but, you know, obviously maxing how much I can learn when I'm with her. But she usually lets me out a couple hours early every day because the last few patients of the day are usually just annual wellness visits. She doesn't think those are really the best way for me to learn medicine, so she usually just has me go home. So today I was only with her from 7:40 till 3 p.m. now. But I just find it so tiring, and I don't know why. It's not that I don't like it. I still enjoy it a lot, you know, but I'm just so tired. Right, so you guys know that I don't drink coffee, but I am very tired, and it's almost 4 o'clock. I'm about to go do a volunteering shift at this place that hands out meals every single night. You know, they feed the homeless population, those struggling with addiction, those who are currently in recovery, those with disabilities, and I volunteered last Friday. It was a great experience. I can tell that all of the volunteers are very burnt out though, and I feel bad for them. Of course, I feel bad for the people who are coming in too, but I just feel like since I live basically across the street from, you know, the church where they host all the meals, I should just go as often as I can. On the days that I get out of my rotation early, I'm just gonna go if I can make it in time, because they really, really need the help, and I'm like the only new person there. So I feel like I'm a breath of fresh air for them because they just seem so burnt out and overworked. And you know, it's volunteer work, so it's not like they're getting paid for it. But the only way I'm gonna make it through that is with this energy drink. Because if I sit on that couch right now, I could definitely fall asleep. I could definitely fall asleep. So after I volunteered on Friday, I could tell that they definitely needed help with food preparation and cleaning and handing out drinks and meals and all of that. So I'm gonna try to go as often as I can, but I also saw that they were running really low on socks. A lot of people were coming in without jackets, even though it was quite literally 27 degrees out. So this weekend I went home to my parents. I asked them and my brother and my friends to gather all of their jackets that they no longer wear. And I donated all of the jackets to the meal program yesterday for them to give out. And I also bought a bunch of socks because, you know, I feel like one of the number 1 things that homeless people need is socks. And I know it seems like such a basic thing to have, but you know, socks can get expensive and you can never have enough socks. So I bought a bunch of socks. There was also a great deal at Marshall's where I got a 3-pack of hats for $10. So I got some winter hats for them. And I donated a bunch of my hoodies and my sweaters and Eric's hoodies and crew neck sweaters, and hopefully it's helpful. I know they're gonna get a lot more use out of it than we do, so I just wanna help as much as I can. I know I seem so dead right now, but that's because I am. I really am.
You can't do that.
Am I really not allowed to? So I want to give you guys a little update about how yesterday went, because I did something exciting and new and fun. And basically I did a mole excision on someone's back. He had a long history of a lot of sun exposure, and when you look at this one particular mole, it had irregular borders and it wasn't uniform in color throughout. So it looked sort of suspicious, so to be safe, we excised the mole and sent it off to pathology. And by we, I mean I had never seen this be done. Basically, my attending drew on a piece of paper what I was going to do, and then he just brought me in there and walked me through the process. So, you know, same as with the shave biopsy, betadine to clean it up, a little bit of alcohol, put in the lidocaine to numb up his back, and then took a scalpel this time instead of the shaving tool. I took a scalpel, And to my surprise, the skin on the back is very thick and tough. So trying to cut through it with the scalpel was hard. I really underestimated how much pressure I would need to use. Getting through the skin on the back was tough. So I took the scalpel and I started carving around the mole. It was in a 1:3 ratio. So 1 to 1 here in the width of the mole. And then it was to a 3 ratio lengthwise. So it was 3 to 1. I probably just explained that so terribly, but basically it was 3 to 1 ratio. It was an oval shape. I carved out the oval shape, dropped it off in the little specimen, and then it was sent off to pathology. And then I sutured it. Guys, I haven't done sutures on a human ever. I've only done it on those little rubbery tools that you can get off of Amazon, and I only did that once. It was very fun, but I honestly didn't really remember how to suture, so he had to walk me through it, and I kid you not, the entire procedure took me 30 minutes, even though it probably would have taken him about 5. So I definitely slowed him down, and I felt really bad about it. But he was like, I know you slowed me down, but that's kind of the point. If you were able to do all that as fast as I could, then I would be wondering what the heck have I been doing this whole time? So he made me feel a lot better about the situation, and it was a fun experience, and I'm sure the more I do it, the better I'll get. So it's all about the experience, and it's all about learning. And I'm really grateful that he trusted me to do it, and that the patient allowed me to do it, so that was pretty awesome. So I just got out of the wound clinic. It was only a half day, and I kind of wish I was able to stay there for longer because I really, really enjoyed it. Even though I know I've mentioned that skin stuff really freaks me out, I'm starting to get used to it, and it doesn't freak me out nearly as much anymore. I actually really enjoy looking at wounds and learning about them and seeing what looks infected versus not, what's weeping versus not, and what a closed wound looked like versus when it's still open. And I feel like I learned so much today, and I think that one day when I practice, I would love to be able to do some wound care myself, like for people who have severe lymphedema and breakdown of skin, people who have venous ulcers or diabetic ulcers. I really, really enjoyed it, and the process of taking care of it was just super satisfying, and I really liked it. Okay, let's talk a little bit because I really, really enjoyed my day in the wound clinic. So today was a wound clinic day as one of my selectives for family medicine. And although I don't like skin conditions because they freak me out, the parts that freak me out are the things that look like a bunch of holes or a bunch of raised bumps close to each other because I have tryptophobia, and that's the type of skin stuff that I'm very afraid of. But something about wounds and like weeping wounds has always been very intriguing to me. Even when I was a kid, whenever someone would like fall and scrape their elbow and they would be bleeding, I would want to take care of it. I don't know why, but I always had this urge to just like clean it and wrap it and take care of it. So when I went to the wound clinic today, I wasn't really sure what I was expecting to see other than some wounds. There were 2 patients in particular who really stood out to me. One patient was an older gentleman, close to 80 years old. He had a severe ulcer on his left big toe, and it was non-healing, and it got to the point where I could see his bone, and the tissue around it was necrotic. It was a severe infection, but he is so sick and so frail that surgery is not an option for him because he would most likely die on the table. So at this point, it's just palliative care for that wound on his toe. I was really grateful to have been able to see that and know what it looks like. Other patient that I want to tell you guys about, oh my gosh, this poor woman, severe lymphedema, like so severe that I don't even know how she was able to sit up to get back in her wheelchair. Her calf was so swollen and so filled with fluid that her calf was bigger than my head. And then her thighs were so swollen that they were literally bigger than the width of my entire torso. It looked severe. She was crying. She was so overwhelmed by how many wounds there were. And because her legs were so swollen, the skin was stretched so far that it was just kind of like ripping apart, and her wounds were weeping. She had about 15 wounds from her thigh down. And because they kept weeping and weeping, the surrounding skin was also breaking down. And it just looked so incredibly painful. And she had been dealing with this for so long. So I felt so bad. But the process of watching them clean out the wounds and bandage it and compress it was very satisfying. And she said that afterwards her legs were feeling a lot better. So the immediate satisfaction of being able to take care of something acute like that was really rewarding. And I think that an ideal day in my practice one day would be some annual physicals, some follow-up visits for chronic disease management, and then some wound care stuff, and then skin lesion removals. I would really enjoy that. And then some psychiatric stuff thrown in there. I would really love that. So an ideal day would just be a mix of kind of all of those things. I am really grateful that I was able to have that wound care experience today, and I would love to go back one day. There was so much to learn and so many different presentations, and it was fun. Like, I really, really liked it a lot. And then the other thing I wanted to tell you guys about is that I did a punch biopsy for the first time last week. I did it by myself. The attending basically took out a piece of paper, drew with a pen kind of what I was going to be doing. And then when I went in the room, he went in with me and just had me do the procedure myself. So this person had a lesion on their back, and it looked like it could have been a melanoma. It was on a sun-exposed area. So I took the little punch biopsy tool, which kind of looks like, it's like a little skinny tube, and you literally put it on the skin, and then you twist it back and forth until you go deep enough into the skin that when you pull it out, you can grab the lesion with a pair of tweezers and then pluck it out, send it off to biopsy. And that was weird. Sorry, that was like a really weird angle, but hopefully you understood what I was doing. And then I was able to stitch it up all by myself. The week before that, it took me 30 minutes to do a skin lesion removal and then suture. And then last week, it only took me 20 minutes. So I'm getting better. I feel like crap. Oh, that's better now. So yesterday, I started having a dry cough, but that was it. I had no other symptoms. And then when I woke up this morning, my throat was on frickin' fire. It was on fire, and it hurt so bad every time I coughed. So I took a COVID test, and I was actually really worried that I got COVID because I haven't gotten COVID yet. So I was like, oh my God, is this really happening? Am I about to get COVID? But the test was negative. So I feel like I probably just have any generic like viral illness because I know a lot of crap is going around right now. I did get my flu shot. It could still be the flu. I don't know. But at this point, I'm also losing my voice, as you can tell. Like, I'm actually screaming right now and like nothing is coming out. You know what I mean? Because how am I going to talk to patients like this? You know, like, when did your symptoms start? What makes it better or worse? You know, I sound horrific. So anyway, I really thought I was going to use this day at home to do a lot of practice questions because I am very much behind and I have my comat next week. But, I basically slept the entire day and it's 4 o'clock. Tell me this is not the nicest looking convenient MD you have ever seen. The floors, like, it just looks brand spanking new. This door is so nice. I just got out of convenient MD. And the only reason I went is because I've missed the last 3 days of my rotations and I have to get a note from a doctor. But it turns out I actually do have influenza A. This is the first time I've ever gotten the actual flu. That explains why I feel like really garbage. Hi, let's check in. It's been a little while. It's Sunday evening. Last night was the first night in the whole week that I was actually able to sleep through the night without waking up in the middle of the night dripping in my own sweat. So basically the cold sweats are gone, the sore throat is mostly gone, the congestion is still a little bit there, but nothing like it was before. The cough is mostly gone, body aches are almost gone, fever's totally gone. So great, young, healthy. I was able to fight off the flu like no big deal, except I was pretty wrecked for the last week, so I guess it kind of was a big deal. I definitely missed seeing patients and being busy and being able to help them and be useful in some type of way, because when I was sick over this past week, I literally was either in bed or on this couch feeling like I was just rotting away and being completely useless. So I definitely missed seeing patients in person. And I have fallen behind on my questions a bit. So my plan originally was to do 200 questions a week so that I would be done with the Amboss Q Bank by the end of the semester, but I still have about 350 questions left, which it's not going to be done by the end of the semester. It's going to be done probably by the end of December, which is totally fine. I gave myself some leeway anyway, just in case something like this happened. I mean, we're almost done with it. There were over 3,000 questions in the Q Bank, and I think I have 350-ish left, so no big deal. Starting tomorrow And for the rest of the week, I'm going to be focusing on the TrueLearn Q-Bank because I have my family medicine comat on Friday. And based on what I've heard from other students, the family medicine comat is really tough because it covers basically everything. So hopefully the 360 or so questions that are available on the TrueLearn Q-Bank will be enough to help me feel prepared for the exam. And since there are about 360 of them and I need to have them done before my exam on Friday, I'm thinking that tomorrow, Tuesday, Wednesday, and Thursday, I'll have to do about 90 questions a day, which is kind of a lot, but it needs to be done, so it will get done. I'm feeling slightly overwhelmed because I know the exam on Friday is going to be hard, and the idea of doing close to 100 questions a day is a little bit daunting at this point, but I have no other choice. I did this to myself, so I will now deal with the consequences. Alrighty, the time has come. It's time to do some questions. I'm going to aim to try to get about 100 of them done today. So let's see, we got to go to Comat Family Medicine, start a new test, and then let's see how many questions I have available. 335. Okay, so I'm going to click on all of these because I want all of these to be potential questions that I can get. And we'll start with 25. Yeah, we'll do 4 sections of 25. That'll be good. All right, so I just finished my first 25 question session. It took me 21.5 minutes because I spent 52 seconds per question, which is not bad. And this is important to know because you want to make sure that when it comes to test day, you're not going to be running out of time because you've practiced answering the questions quickly enough that you won't have to worry about that. So I scored a 72. And one of the things I really like about TrueLearn is that they'll tell you the national average. So for people around the country who took the same question bank, you got a 72 compared to their 61, which is 11% higher. So at first you might be like, 72%, not great. That's kind of like a C, but compared to the national average, you actually did 11% better. So that's actually pretty good news. Alrighty, it is day 2 of doing 100 TrueLearn questions in preparation for my exam on Friday. I was actually able to get 75 questions done in the clinic today because even though I showed up at 7:30, my preceptor had a meeting until 9, so I had an hour and a half to just do practice questions. So I was able to get 75 of them done. So now I just have to do 25 more and then I'll be done for today. So let's do this. Let's do a couple together because, I don't know, sometimes thinking out loud helps me a little bit. 61-year-old male, follow-up, 2 weeks after undergoing coronary angiography and stent placement in proximal left anterior descending artery. Since the procedure, he's not had any chest pain, shortness of breath, or palpitations. He has hypertension. Those are his meds. Okay. Good hemoglobin A1C, good cholesterol, good cholesterol, good. The most appropriate recommendation for lipid management is, well, he has known coronary artery disease, so he needs to be taking a statin regardless of the fact that his lipids are in good control. At least I'm pretty sure that's the answer. 65-year-old female, urgent care, 3 days of right forehead pain, constant and burning, very painful with even light touch. Interesting. She has a history of migraines, but this is different. Clusters of erythematous papules and vesicles extending from her right frontotemporal prominence down to her nasal bridge, crusted erosions. Oh, she sounds like she has what, guys? What does she have? She has shingles. 54-year-old female, foot pain. She can ambulate without difficulty and pain, but her heel is painful, especially in the morning. Sounds like she has what, guys? Heel pain specifically in the morning? Plantar fasciitis. Who need rest, NSAIDs, and OMT? Heck yeah. 43-year-old Caucasian male, general maintenance exam. He has mild intermittent asthma. She had tonsillectomy, albuterol once or twice a week. Total cholesterol is elevated, LDL is elevated, triglycerides a little elevated. Which of the following is the most appropriate recommendation at this time? Okay, he's 43, so he doesn't have any known cardiac disease. His LDL is not greater than 190. He does not have diabetes. He has a family history of diabetes. So there's no indication for a statin at this time. So we're gonna do lifestyle. 67-year-old male, elective inguinal hernia repair. He is quite anemic, microcytic anemia, low ferritin. Fecal occult blood test is negative. Which of the following is the most appropriate next step? Well, you're 67 and you're anemic. You got to get a colonoscopy, my dude. You must. You must. Okay, I'm going to do the rest of these questions on my own now. So this is the last patient I was ever going to see on this family medicine rotation. The last patient I was ever going to see this semester. And this is how the visit went. Patient comes in with 2 weeks of cough.
Medical assistant puts her in the room, tries to flu swab her and COVID swab her, but the patient declines and said she didn't want to get swabbed. I go in the room, I introduce myself, I ask the patient what brings her into the office, and I confirm with her that she did not want to get swabbed for flu or COVID. And she says, no, I don't want to get swabbed for either of those because I don't want any of you people sticking anything up my nose. And I said, okay, that's fair. I asked her, have you taken a COVID test at home at all? And she said, no, because I know that I don't have COVID. And she gets so mad at me for asking that when like literally I'm just asking like, tell me more about your symptoms. And she says, I had bronchitis before and this feels exactly like bronchitis. I don't even want to be here. I just want my antibiotics. Just give me my antibiotics. I can't believe you all made me drive here just for this visit when I know what's wrong with me. I just wanted a prescription for antibiotics. In which I respond, the reason why we have you come in the office is because we want to make sure we gather an accurate history and perform a physical exam to make sure that antibiotics are actually indicated because we don't want to be prescribing medications that won't be useful. She looks at me and she says, honestly, I really don't care for you and I'm not having this conversation with you. And this is all bullshit that you guys made me come here. She stands up, puts on her jacket, swears at me a little bit, and then walks out of the room. I go back to my attending. She's looking at me like, what are you doing? It's only been like 30 seconds since you went to see the patient. And I say, the patient just walked out on me. And the medical assistant was like, oh, I forgot that the patient didn't want a medical student in the room. So she runs to chase after the patient. The attending asked me what happened in the room. I told her everything that the patient said to me. She said she was really unhappy that the patient talked to me that way. The medical assistant puts the patient back in the room, comes back to the attending, and tells her, okay, the patient's back in the room, you can go see her. And the attending tells her, honestly, I really don't like the way that that patient talked to b.eeana. To which the medical assistant responds, well, there's two sides to every story. And I'm sitting there, my ears peak. I'm like, what could the other side of the story possibly be? Like, literally, what could it be? The patient barely let me speak. So what could the story be? And she told the medical assistant that I came into the room aggressively and told her, if you don't let me get a flu or COVID swab, there's nothing I can do for you at this visit. Which I put on my life. I did not say that to her. I have never said that to any patient. I will never say that to any patient. And I definitely didn't speak to her in that tone. So I don't even care that the patient says she doesn't care for me, that this whole visit is bullshit, that she doesn't want to talk to me. Like, I don't care about that. What upset me was that she lied to the medical assistant about what happened. And I don't like that I am being painted as that type of medical student. Because as a medical student, I'm literally at the bottom of the totem pole. Like, nobody cares. Nobody's out here protecting me. No one's out here defending me. So if a patient's going to tell a story like that, it just makes me look bad. What is my word against the patients? Literally nothing. Because as a third-year med student, you're really not supposed to be like that great at practicing medicine yet. So is it really that hard to believe that a medical student might have said the wrong thing and lost her cool with the patient in the room? No, it's really not that far-fetched, except that I did not do that. So I was so upset that she told the medical assistant that that's how the situation went down, because it totally wasn't. And I know this isn't going to be an isolated incident. I know that patients in the future are going to be mean to me, are going to say rude things to me, are going to swear at me, are probably going to be racist towards me. And it upsets me knowing that, like, I'm kind of just going to have to let it happen, especially when I'm a medical student, because I have no power and nobody's there protecting me. So that was really fun. Hey, my exam starts in 2 minutes. I'm as ready as I'm going to be, so, you know, hopefully it goes well. All I have to do is pass.
Alrighty guys, so that marks the end of my family medicine rotation. My shelf exam was definitely difficult. There was a lot of information that was covered, a lot of things that were not in TrueLearn, that were not on AMBOSS, that were not covered during my rotation. So the exam was tough, but I'm pretty sure I passed. And, you know, that's the end of the rotation. There were parts that I loved and parts that I was not a huge fan of, but, you know, it is what it is. I'm still glad that I had the experience. I'm still grateful for all of the experiences that I had. Thank you guys so much for watching this video. I hope you guys liked it. And if you did, make sure you like, comment, share, and subscribe, and I will see you guys in my next video. Bye!